Good afternoon, everyone, and thanks so much for joining us. I'm Will DuPree here in the KXAN live studio. Today, the new school year began for the Round Rock Independent School District. It's, of course, like many districts, starting off virtually, with boys and girls listening from home to their teachers' lessons and not really interacting with their classmates or friends in person like they normally would. And we wondered how that change because of the pandemic may affect students. Plus, we wanted to hear how teachers are dealing with this new reality and their concerns about their own health and safety. We're fortunate today to have two administrators from Round Rock ISD join us for a conversation to talk through some of these very topics. Please welcome Dr. Amy Grosso and Dr. LaShanda Lewis. Thank you both for taking the time to be here. We really do appreciate it.
Thank you for having us.
Just so everyone's aware, Dr. Grosso, she works as the district's Director of Behavioral Health Services, and Dr. Lewis, you are the Coordinator for Counseling Services at Round Rock Schools. So you both have very much a lot of experience and some really great perspectives about what we're going to talk about today. First though, it is the first day of school held virtually for students and parents in Round Rock ISD. Dr. Grosso, your son started school today virtually. How did that go with everything?
Yeah, he's in first grade and he's in dual language, which is always an adventure because my husband and I don't speak Spanish and majority of his class is in Spanish. But you know, it went really well. I think he was a little apprehensive. He had some sadness that he wasn't physically going to school, and we talked through that. But once he logged on and was able to see his teacher and interact with his classmates, he was just in a great mood. You know, he was wondering, there was a few times like the video froze and he was like, my video's freezing. I'm like, it's happened to all of us this summer. Like, that's normal. It's okay. But from my perspective as a parent, I was so thankful that he was able to connect with classmates again.
I wanted to show a tweet that you sent out just a little bit earlier, so everyone at home is looking at it at this point. It's your son seated at a desk and he has a background for his little setup there. How did you kind of figure out what you wanted him to have there with the start of the school year?
You know, just as much as we as educators were in crisis mode back in March and how we were doing virtual learning, I think as parents we were too. You know, it was like, just get through the next day, get through the next day. And then knowing that we were going to have, that we were coming back virtually, I was like, well, his space needs to be comfortable for him. And if I wanted him to be excited about starting virtually, we needed to make it a big event. And so that was like setting up his little space. He got a little desk. It's in his bedroom, but we sort of housed it off. I had fabric that I misproportioned how big certain things were for masks. And so it was just a lot of like, we used a lot of things we had around the house. We didn't buy that much new, but it was new to him. And he was excited to have his own space as much as mommy and daddy have their own space for work from home. My husband and I both are virtually working from home. So he wanted to fill that special space also.
Dr. Lewis, turning to you now, we just heard how Dr. Grosso and the first day of school went for her. What's been your impression from what you've seen and heard with the new school year starting?
Well, I can say for my own kids, I have a third grader and a sixth grader, and pretty much the same as Dr. Grosso. They're really excited to get back to school. And as much as my son loves going to school physically, he was excited to see his friends this year. My daughter, who's starting sixth grade, of course, she wanted to be in the building for sixth grade, but she also understood everything that we're going through. But being able to get back onto the virtual platform this year and recognizing some of the students in class and recognizing that those were friends that they've had in previous years was amazing. I'm hearing a lot of great things from parents across the district, whether it's our own personal district, Round Rock ISD, or districts, neighboring districts. Parents are saying they're glad they have a way to get their kids reconnected to those relationships that they've missed so much during this time, the last 5 months.
Since you're both parents, what were the conversations that you had with your own kids to kind of guide how they are going to approach this new school year? What are the things that you all brought up to them that hopefully other parents can maybe pick up from too?
Well, for me, my kids are age-wise in a little different place, but it was really starting very early with them about being honest and truthful about what was going on. I think sometimes as parents, we want to shield our kids from some of the bad news that's going on, which is absolutely perfect. But I think it's also important that we're honest with them and honest with ourselves about how we're feeling about what's going on. And then allowing ourselves to have those emotions and those feelings, but then also recognizing those in our children as well, and allowing them to say, you know what, I don't like this. I'm excited about this. And I'm really allowing them to express themselves the way that they are.
I would agree 100%. I did a virtual session for through Facebook Live for our Council of PTAs a few weeks ago on like how to cope with a year of unknowns for parents. And a lot of it is, you know, we like our kids to be happy. We like them to be excited. And when they experience emotions of sadness or disappointment, we want to sort of rescue them from that and be like, you shouldn't feel this way. And it's like, no, they can. Like, they're allowed to feel sad. They're allowed to feel disappointed. So are we. But how do we help them acknowledge those and then move forward? Your expectation can't be that it's going to be exactly the same, right? It's going to be different, but looking for those moments of, but what's good about it too? You know, like what are some good things? We have reflected so much on, we have so much family time and we've never had this much family time. So I think balancing the accepting the hard emotions and letting us feel it, but then also being grateful for things that have happened.
Yeah, I think that's, oh, I'm sorry.
No, go ahead.
I was just going to say, I think a lot of our conversations just in society right now have been focused on, well, things are so different than what we had back in February. But making sure that we're, you know, looking at what are some of the positives that are going to come out of this. I think as a society, we're going to be more resilient. Our kids are going to be more resilient and more patient. And like Dr. Grosso said, that family time that we have, that we miss out on because of our busy lives is something that is highlighted right now.
What I was going to be asking about is a lot of families, I'm sure, are talking about how do you keep kids engaged while they're sitting at home? Normally they'd be able to go and play whenever they might want to, but they need to sit and focus on their schooling. How do you approach that? What's some advice to give to parents for that situation? Because that's what they're all facing right now.
Yeah, and I think Round Rock, the schedules that we've put out and stuff, they've done a wonderful job of our kids are not on their computers all day with live interaction the whole time. They've been very intentional at every grade level of where there are breaks. There's that synchronous live time, and then there's the asynchronous on their own, and being able, how do you help them utilize their breaks? Like my son had a 15-minute break and he's like, oh, I want a snack. And I'm like, go get a snack. Like, you know, you can move. Or he had a little longer break, like go outside and play. So I think as parents too, sort of checking what are our expectations, right? And that realizing when our kids in school, they're not sitting at a desk the whole entire time. Mm-hmm. So letting them get up when they need to get up, right? And if it's the asynchronous time, if they need to get up and walk around, we don't need to stop them from doing that. And so realizing that all of us, none of us like to sit at a computer for 8 hours at a time. So giving our students and our children some of that grace that we need right now.
And allowing them some independence as well. Of course, we're looking at kids pre-K through 12th grade. And so it's going to look a little different depending on the age and the maturity of the child. But sit down and have those conversations with them. Well, you have this time that you have to be synchronous. You have to have that live conversation or interaction with your teacher. But you also have this block of time where you can get up and go get a snack, or you can get up and go run around outside. Sit down and maybe come up with some things that your child would want to do that doesn't involve technology, because they are spending probably more time than normal in front of the computer. Giving them some time to think through what are some things that I really enjoy doing that has nothing to do with the computer or my cell phone. And maybe that's even a time for mom and dad to take time from work and say, hey, let's just have a conversation with one another. So yeah, bringing them into that conversation and giving them some independence on how to use that time away from learning.
And I would say that independence part, I mean, you're completely right that even like he's in first grade, we printed off his schedule and we color coded like when is the live time, when is it not, and here are your breaks. And I think as parents, sometimes we don't think our kids can do something at a younger age. And even today, he was just like, okay, let me look at my schedule. And he was like, what time is it? Oh, wait, I have a like, there's a clock on my computer. So I think sometimes mom and dad need to step back.
That's some good advice, I think, too. I have a specific question for you, Dr. Grosso. Your job, part of it, is to oversee programs for students who are in crisis or at risk. How do you still check on those kids and work with them while everything is still being held remotely for the time being?
Absolutely. We have a lot of different things in place. One of them is our anonymous alert reporting system. And so we've had for years. We redid some of the categories this summer. One's just for concern for student well-being. So anybody can put that in there. And so those are all followed up. Also, it's a lot of partnerships between behavioral health and our counseling services department and even our teachers, like letting teachers know these are some warning signs to look out for. It's not your job to fix it, but then you can reach out to our counselors who are trained and equipped to be able to do those things. We've also, starting last March, our mental health centers, which is a partnership with Bluebonnet Trails, they went completely televideo. So our students are still able to be able to have therapy through the district. And so that's still going on. So I've been amazed, when we're pushed into a crisis and we have to figure it out, that we figured it out and really looking for ways to support our students.
It has been amazing to see how operations have pivoted in so many different ways. And that's what I wanted to ask you about, Dr. Lewis. You work with counselors at all the different campuses at Round Rock schools. What kind of outreach are they now doing to be able to connect with students and families?
It really is similar to what we see with our Bluebonnet Trails services. Our counselors have the ability to work with our students virtually. And so for our counselors, especially since they're working K-12, it really depends on what is that comfort level for our students. So it could be through a video system like we have here, or it could be, we forget that we can also pick up the phone and call people. So our counselors are there for our students through Google, our Google Meet, also by telephone, but our students also like to send in emails. And so our students can connect with our counselors through emails as well. And that's the same for parents. If they have a question or concern, or they just really need some advice on how to support their child during this time, the counselors are there for them.
When everything with the pandemic started happening, I mean, it's amazing to hear about these things being set up virtually. But was there a moment like when all this was unfolding, like, how are we going to handle this? How are we going to deliver these same services that families would normally get at the actual school building, but they can't actually come here and get those?
No, I think it's one of those that it's overwhelming at first, and then one little step at a time. And then as we start this year, it's like, look at how much has been accomplished and how education as a whole has been completely changed to a virtual environment in not very many months. I mean, these are huge changes that traditionally could take years of implementation. Like even with televideo, like that's been happening a lot with mental health in different areas and stuff, but it wasn't very broad range. It was like, we can't do that. And then it's like, well, you have to now, so you can.
One other thing that we learned about this week is that at least 18 teachers have resigned at another Williamson County School District, Georgetown ISD, because many of them were concerned about putting themselves and their families at risk by returning to campuses. Now, it's important to say Round Rock ISD is not doing that just yet, but September 10th is the official start date to potentially begin some in-person classes. How are you helping teachers deal with that anxiety and concern that they may be putting themselves and their families at risk by actually holding in-person classes?
And I'll say I do a lot of professional development for our staff before school starts. And more than ever, I was requested to do ones on self-care. And it wasn't just self-care of like taking a walk. It was really like processing our emotions and feelings on what's going on and what's in our control and what's not in our control. And after each one of those, very much promoting, we have an employee assistance program that offers free counseling for our staff and their families, also showing them how to utilize their benefits for that, like their health insurance. And so I think really making sure, not just physically, but emotionally and mentally, they have all the supports they need, and making it, we've had all of these, but really making sure they know they're available and it's all televideo, and giving them the sort of destigmatizing the idea of getting help for mental health concerns and saying your anxiety it's okay. But there's someone who can help you process through that, so you're not living in constant fear.
We also heard about classes being held in person while Round Rock's not doing that at the moment, but Thrall ISD is. And I just want to show people at home some pictures of kids gathered in the cafeterias and in the hallways, all separated, and seeing this new reality of social distancing, mask wearing in school, keeping kids apart. That is a difficult thing no matter what age they are at this point. But some people may look at those pictures and think it's a little bit of a sad situation and those kids aren't getting like what they normally would. What's your reaction to, the way that things have unfolded for these districts?
Well, I think first and foremost, we have to recognize that each one of us has a different situation. And so whatever decisions we make for ourselves and for our children is the best decision that we can make for our family. And so while some of us may not choose to send our kids virtually, some parents may choose to send their kids virtually, and we have to honor everyone's opinion and decisions. But I think I can't really speak for all other school districts, but I can speak for Round Rock ISD that as much attention as we pay to how will we do virtual for our students, we've also done that same thing with what is going to happen with our students when they come back into the buildings. And trust that schools have thought of almost every scenario possible on how to not only keep your kids safe while they're with us in our buildings, but also how to make sure that they are emotionally happy and emotionally okay while they're in school. So just like Dr. Grosso was saying earlier, in a traditional school setting, let's go way back to February, our kids, regardless of their grade level, they were not sitting in their desk that entire time that they were in school. There was time that they were up and moving around, even if it was only within that classroom for certain populations, or if it was time out at recess. So for our students, once they come back to our buildings, they're still going to have that time to move around and socialize, but they're going to be able to do so at a way that is safe and that social distance for them.
And I will say with that too, and I get it, seeing the pictures, I remember seeing them, what was it, last week when they originally came out, that we're comparing it to what last year was, right? Like we compare it to what happened last year. And just like I told teachers, like you have to erase the expectations of what last year was, because it's not the same, right? We watch NBA games with virtual fans. Major League Baseball games have no fans. Like everybody's trying to figure this out. And so you can't have that same expectation for this year and the starting of this year than we did last year. And, while we might say, oh, that's so sad, but then it's like, but they're still learning and they're still engaging. And I honestly feel like kids are a lot more resilient and a lot more able to cope and stuff than sometimes even us as adults are. Like my son's excited to wear a mask because, like he's just like, and he gets it. And I think kids sometimes get it better than we do. We have to stay 6 feet apart because there's a virus. So I do sometimes think we are just as adults, because we have so much more experience and so many more years of this is what school looks like. And it looks different, and different doesn't always mean it's bad.
Changing perspective is important.
Absolutely.
Yeah.
Yes, we've all learned over the past few months, for sure. Another thing, going back to Thrall, again, another school district there in Williamson County, an employee tested positive for COVID-19 this week, and a student and another person are now in quarantine for possible exposure. Now, a lot of parents are comfortable with sending their kids back to school, of course, but some see what is happening there, and it raises their anxieties more about the potential to send kids back to Round Rock ISD. What do you say to those parents who might have those concerns about potential health risks for going back to school?
Well, I mean, there's the reality that we're in a pandemic, right? We would not be virtually learning right now if that wasn't true. And so there is elements of fear that is normal and is justifiable. But when does it become where it's stopping us from doing what we need to do? And realizing that there are things in place and that you do quarantine because that is the ultimate safety measure that we can do to protect you I would be more fearful if the district wasn't doing things like quarantining or, social distancing, that then they wouldn't be taking it serious, but they are. And I think it's once again, one of those things that we're setting and having to live in a little bit of uncomfortable emotion, which we don't want to ever. But there is an element of, we are living in a pandemic.
I think that's important to keep in mind, that schools are doing the best that they can to keep everybody safe. But ultimately, as parents, it is our job to make the best decisions for our children. And keep in mind that whatever decision you make for your family is an okay decision. And you should go with it. But I think also, to kind of piggyback on what Dr. Grosso said, this is times like we've never seen before, and we're going to have questions and concerns that we may not be able to get answered right now. And one thing about humans is that we like a sense of control. And right now there's so many things that we don't have control over. And what we can do is look at the things that we do have control over. What can we put in place so that we are safe, that our children are safe, and that needs to be our focus for now.
To ask a personal question, we had a conversation with a couple of Round Rock parents just earlier this week, and both of them are keeping their kids learning virtually, even when the option is available to go back to a building. For you, both of you, I mean, you have children that are currently in school. Where do you all stand? Do you feel comfortable sending your kids back to the buildings, or do you plan to keep them at home?
We have signed up through Round Rock, like he has signed up to go back on September 10th. And it's for a variety of reasons. And it's exactly what Dr. Lewis said. Like, I often say sometimes there's times in life where there's not a right or wrong decision. There's just a decision that we make, and we have to live into it. Do I have some fears? Yes, but I have fears when we go for a walk, like, right? Like, I'm an anxious person by nature, and but I fully trust the systems that we've put in Round Rock, and I fully trust that it's as safe as it can be for that type of environment, and it works for our family. And so, yeah, mine will be going back, and he is counting down the days. I told him that could always change, and he didn't like that, but that's where we are as a family.
And yes, absolutely. We tell our kids all the time that, sometimes you're giving choice A and choice B, and neither one of them really works for you. And so you have to choose the one that works best. And so, yes, we say that all the time as well, Dr. Gross. So sometimes you don't really have a choice in between those choices. And parents have to keep that in mind. For us personally, we have decided that our kids will stay home until school is back open 100%. We are lucky to be in a place where we can do that. Currently, we're both working from home, but I also live right down the street from my job. So it wouldn't be that much for me to get back home once we do go back into the building. But I also recognize that that is not the situation for every family. Some parents have to send their kids because they have to go to work and their kids cannot stay home alone. Or various different situations. But for us, we're choosing that our kids will be home until they can be 100% back in the building.
How often are you hearing from families who are struggling to not only monitor their kids learning virtually, but also having to do work to go and be able to provide for their families?
Yeah, I mean, I'll just speak personally of working from home even all summer. I mean, Dr. Lewis and I both have been working all summer with kids at home. And that being, like, we're in a very fortunate situation that I can work from home and do that, but it doesn't mean that it's not hard. And it doesn't mean that I have to have different expectations of myself. I can't work like I did when I'm at the office. Working is in chunks, right? Like, so 8 to 5 is not a reality because there might be chunks in the middle of the day. I have to be mom and I have to do different things. And so I think everyone is just trying to do we're trying to do the best we can and survive, right, in this time. And I think what happens, we get in really hard times when we try to compare our experiences to someone else and say, I need to be like that person and how they're doing it, because everybody's situation is different. I mean, I even catch myself like, oh my gosh, how much TV has my son watched today? And not to feel guilty about that, but to realize we're in a pandemic, and it's been 5 months. And I think that's an important perspective for us to have. I've heard language by politicians and even, of we're losing a generation of students, that it's been 5 months. and kids are resilient and teachers are amazing. They're not lost forever. Like it's a small, when we look at the grand scheme of their whole K-12 education, it is a small little part. And I think we have to have that perspective going forward.
I absolutely echo everything Dr. Grosso said. Like, we have to give ourselves some grace and realize that what we were doing a few months ago is not going to be what we can do right now. Working from home, like Dr. Grosso said, it may look a little different, especially depending on the age of your children. We have a coworker that every time we get on a meeting, her little baby is right there. And I'm like, I can't imagine trying to work from home and still take care of an infant child. So make sure that you're not comparing yourself to someone else, because their situation is going to be very different than yours. I know I've said this multiple times, but as parents, we have to do what's best for us, and we have to do what's best for us first. Because if we don't recognize and take care of our own emotions and our feelings, our own well-being, then we can't be there for our children.
Absolutely. And to get the judgment out of there, and judgment for ourselves, but judgment for others. You know, we've had people who have had to go back physically to their jobs months and months ago, essential workers, and their children have been in daycare settings or different settings, and to have judgment and say that it would be horrible to send your kid to that. Like, we don't know their circumstance. And, you know, I think we're all trying to do the best we can for our families and our kids, and every situation is different. And the judgment doesn't help anyone.
Yeah. Dr. Grosso, Dr. Lewis, we are just about at the end of our conversation and our time together. So before we go and in this portion of our stream, I want to give you all a chance to talk about any other things that families that you would like them to know at this time.
The biggest thing for me, I'm continuing to do a partnership with Round Rock ISD Council of PTAs. They're a Facebook page. Every few weeks, we'll be doing a live session on different mental health strategies, how to help your kid, a variety of different topics. So if you go to their page and look out for that calendar, it's just a way, virtually, we can get out a lot of information. And because there's so much more on parents than there ever has been. And so I think that's an important thing, that we're able to continue to support parents, even if it's virtual.
And I'm speaking for counselors in Round Rock ISD. But counselors, whatever school district your child is in, your counselor is absolutely amazing. They have all been trained in supporting students in mental health. And so reach out to your school counselor if you have any concerns or any questions about what is going on with your child. And I would also say each one of our districts in the area, whether it's Round Rock ISD or surrounding school district, have programs for families that are struggling. There are homeless programs, there are families in transition programs are there to support families as a unit, work through any of the financial or personal struggles that families are going through. So get connected to your schools, even if this is the first time you've never been able, or you've never had the need to call your school for anything. Reach out to your school counselors, and they can connect you to resources, not only within your school, but also in your community. And then lastly, give yourself grace. This is a time that none of us have ever gone through. It's a difficult time, and we have to allow ourselves to be honest with our emotions and understand that we're going to survive and make it through.
Dr. LaShanda Lewis, Dr. Amy Grosso, thank you both so much for giving us this time to be able to talk about these different topics. There are so much more that we could address, but I appreciate you all giving us this time just to at least talk about these different topics.
Thank you so much for having us.
All right, everybody. I'm Will DuPree once again here in the KXAN live studio. We're going to take a brief pause in our live stream, and coming up just after this, we're going to bring you a conversation that our morning anchor Sally Hernandez had with Round Rock ISD's superintendent this morning to talk about how the virtual start of the school year got off today. So please stay with us for just a little bit, and we'll see you right back here in just a moment.